Well, good morning, everyone. As everyone who has ever struggled to maintain a healthy weight can tell you, simple solutions that can be fit into a busy schedule work best, and that often means having areas where you can exercise, like Flushing Meadows Park close by. It means having access to healthier food options like green carts on neighboring bodegas that stock fruits and vegetables. It also means having the tools and information that you need to develop healthier habits. I think the facts are clear. Sugary drink consumption is a key driver of the obesity epidemic in our city and across the United States. And so reducing the amount of sugary drinks you consume is the simplest dietary change that you can make to help you lose weight and maintain a healthy weight. And that's why a number of health and weight loss experts, including Dr. Walter Shapiro, Jenny Craig, South Beach, and the Dukan Diet, are supporting our proposal to limit the portion size of sugary drinks. And we're glad that one of the companies that has been at this the longest, Weight Watchers, is with us today. We've come together because we recognize that the obesity epidemic is one of the most urgent challenges facing our city and our country, and we refuse to stand on the sidelines while millions of our fellow New Yorkers struggle with the health implications of being overweight or obese. A little-known fact is this year, for the first time in the history of the world, more people will die from the effects of eating too much food than from starvation. Just think about that. There's still plenty of people starving around the world, but more will die from the other problem. And the other problem, obesity, is growing at a much more rapid rate than anything else, even more so than people dying from cigarettes or traffic accidents or lots of other things put together. This is the first time a rich person's disease has become a poor person's disease. And that's another little-known fact, that being overweight and the effects of being overweight are most felt by those who can least afford to pay for medical care and don't maybe have the advantages of being able to read all of the scientific data and talk to people who can explain things to them, that why it's in their interest to not be overweight. When we proposed our reform limiting the serving size of sugary drinks earlier this year, it got a lot of people talking. That's a good thing. It's important that people have the knowledge they need to make informed decisions about their health, and that's why we're combining our proposal with an ongoing public education campaign. It builds on the work we've already done to give New Yorkers more information, like calorie counts in restaurants, so they can make better choices about the food they and their families consume. And all this is about giving people choices and giving them information. Nobody is restricting the amount of sodas you can buy or the amount of sodas you can drink. It is simply using portion control to point out to you the effect of drinking too much, or how much you really are drinking, how many calories you're really consuming. And that's exactly, incidentally, what the manufacturers do. People say we shouldn't be dictating what size containers soft drinks come in. The manufacturers have been doing that since day one. So we're just late to the party, maybe, but our objectives are different than theirs. We've also worked to provide New Yorkers with more healthy options, including the creating this program Health Bucks that can be used to purchase fruits and vegetables at farmers markets, and making hundreds of green carts available across the city so that families have more access to fresh produce. And we've launched Shop Healthy NYC to encourage more neighborhood supermarkets and corner stores to give healthy food more space in their shops. We're also working to help more New Yorkers get fit and stay fit, and that includes launching the BeFit NYC fitness search engine last year, available through nyc.gov. BeFit NYC is a one-stop shop for finding free and low-cost fitness activities throughout the city. At the same time, we expanded the number of free classes through programs like Walk NYC and Shape Up NYC. Shape Up NYC, as many of you know, includes 160 free fitness classes every week at 45 locations across the 5 boroughs, including here at Flushing Meadows Park. And now with the BeFit NYC Facebook app, New Yorkers can do more than find a class. They can also create their own events, invite friends, and open it up to all others. So BeFit NYC makes it easier than ever for New Yorkers to join lunchtime walking groups, lifetime as well, and meet up for after-work runs or workout in exercise classes. Another way we're helping people get exercise is through our Make NYC Your Gym campaign, which reminds us that each day, everyday tasks can present easy ways to get fit, and that could mean walking instead of driving or getting off a stop early on the bus or subway. We are taking all these steps because of just how urgent the obesity epidemic is. Nearly 60% of adult New Yorkers struggle with this epidemic, and each faces a greater risk of developing a host of diseases and conditions, including type 2 diabetes, cancer, hypertension, heart disease, kidney disease, liver disease, joint problems, and blindness. And of course, obesity doesn't just affect adults. Among New York City kids, 40% are overweight or obese. And history shows if you're overweight or obese as a child, you're really going to have a problem as an adult. Each faces a higher risk of developing all the diseases I mentioned, and tragically, each also faces a greater risk of early death. In fact, obesity is the second leading cause, just after smoking, of preventable deaths in our city. An estimated 5,800 New Yorkers die each year because they are overweight or obese. That number is skyrocketing, and the number of people dying from the effects of smoking is plummeting. One's going in the right direction. The other, tragically, is not going in the right direction. In addition to the tragic human toll, obesity is also placing a growing burden on public finances. Obesity costs New York City alone roughly $4 billion each year. Nationwide, that number is something like $150 billion each year, and the crisis is not getting better. If we are going to tackle this epidemic and save lives, we have to work together. We have to work on to address the crisis on every front. That includes expanding public awareness and education and increasing access to healthy food options, making it easier for individuals and families to include exercise in their schedule, and implementing sensible reforms. Let me point out that every single one of those things I just said is simply giving you information about what you can do to make your life better. The choice is still up to you. Nobody is prohibiting you from buying or eating or doing anything, including smoking. If you want to smoke, you certainly can smoke. I've defended your right to smoke. It's not a very smart thing to do, but if that's what you want to do, as long as you don't do it where other people are going to breathe your smoke, then you can do that. And the same thing is true with foods. You can eat anything you want. If it's really bad for you, we're going to tell you that it's bad for you, and then you make your own free decision. That's the responsibility of government, to give you the information, and it's the freedom that we all come to expect in the United States, to being able to do what we want to do. Keep in mind that if somebody else, however, does do things that are not good for their health, you may very well be paying for it, because in the end, whether it's through Obamacare or through the emergency rooms at hospitals or any of these other things, we're all going to be paying for those who are sick, and particularly when that is something that is you could be prevented. You can sit there and say, why should I pay? We are going to pay. And so you should be a big advocate of us telling people what's in their interest and then letting them make their own choices. Let me welcome the woman who's spearheading our administration's efforts to help more New Yorkers get healthier and stay healthier in every one of these ways, Deputy Mayor for Health and Human Services, Linda Gibbs. Linda?
Thank you, Mayor. When you think about it, 5,800 people in New York City every year dying slowly, painfully, often silently, but dying. And this is an epidemic that really demands government action. We've done a ton of things. We've put the green carts on the streets. We've done zoning changes to bring more supermarkets into neighborhoods that don't have a lot of fresh fruits and vegetables. We've focused on posting calorie count information. We've increased opportunities for physical fitness and activities. What we know is that the initiative that will have the biggest impact on the reduction in overweight and obesity is in reducing calorie intake. And we hope that the way that this is implemented here in New York City is derived through the reduction in the calories that people consume through sugar-sweetened beverages. The unique thing about sodas and other sweetened beverages is that the calories come with no nutritional value. And so it is the prime candidate for achieving the goal of calorie reduction. It fits within this broad set of initiatives that we have, but the impact of those items, by comparison, are modest to the reduction in calories that we know we can achieve through this initiative. So the time really has come with this awareness for asking the question instead, how is it that government can do this? The time really has come for the question to be, how is it that government is not yet doing this? And we thank Mayor Bloomberg for his leadership, his support to the Department of Health and the Board of Health in taking on big challenges like this and really engaging government in the business that it is responsible for doing.
Linda, thank you. Next, our Health Commissioner, Tom Farley. His leadership really has been instrumental in these efforts, and I'd like him to share a few words. Tom?
Thank you. First, I want to thank Weight Watchers for being here today and supporting our portion rule. Weight Watchers is really the leading group nationally that recommends sensible, healthy eating as a way of maintaining a healthy weight. And also want to thank Rachelle Conley, who you're going to hear about for a minute, for telling her really, truly remarkable story. The obesity epidemic has happened in the last 30 to 40 years in the United States. During that time, our genes haven't changed. People haven't changed. People are no more lazy. People are no more irresponsible. In fact, Americans are the hardest working people on earth, and we're working harder than ever before. What has changed is the world around us. New Yorkers, like Rachelle, are surrounded by cheap, ready-to-eat and ready-to-drink, high-calorie snack foods and beverages. And our portion sizes have grown way beyond humans' needs, especially the portions of sugary drinks. Now, we can't turn the clock back to the 1960s. We're not going to be able to change the world. But we can help people like Rachelle who want to avoid becoming overweight within today's world. And reducing and reintroducing human-sized portions is an important first step. It gives people the choice, but at the same time, it makes healthy choices easier. Now, sugary drinks are particularly important to obesity, and therefore they're particularly important for introducing human-sized portions. They're strongly linked to obesity and weight gain in a number of studies. They have no nutritional value. They don't make you feel full, unlike food. And independent of their effect on weight gain, they increase your risk of heart disease and diabetes. But there's no one thing we're going to be able to do to fix the obesity epidemic. We have to do many other things as well. And as the mayor and the deputy mayor said, we are trying to get people to bring physical activity back into their daily routine with things like Make New York City Your Gym, group exercises. In this recreation center, if you come in here on a Saturday, there will be more than 100 people doing Zumba together. And we have introduced the BeFit NYC website, where, as the mayor said, you can go to find hundreds of opportunities for free or low-cost group exercise classes. Or if you want to create your own class, you can just set it up through Facebook and invite your friends. And we're also promoting fruits and vegetables in many different ways to increase their accessibility, because fruits and vegetables are extremely low in calories and have many health-promoting effects independent of that. So the obesity epidemic is simply something that is too big for us to walk away from. We're going to battle it, and we're determined to win. Thank you.
Tom, thank you. We are grateful to have Weight Watchers' support in tackling the obesity epidemic, and I would like to invite David Burwick, Weight Watchers President for North America, to share a few words. Dave. Thank you for everything.
Thank you. Good morning, everybody. Thank you, Mayor Bloomberg, Deputy Mayor Gibbs, Commissioner Farley. Okay, so I think the mayor shared some of the numbers already. Nearly 76 million Americans are obese, according to local government figures. Obesity greatly increases the risk of type 2 diabetes, a condition that now afflicts 9% of New Yorkers, higher than the national average. And obesity also costs the U.S. healthcare system about $150 billion a year. Now, to date, I'd say there's been a lot of hand-wringing about obesity, but honestly, very little action, which is why I'm here on behalf of Weight Watchers to support the mayor's administration in their efforts to help New Yorkers live healthier. At Weight Watchers, we take a comprehensive approach to weight loss that includes nutrition education, incorporating activity into your daily life, behavior change to foster healthy habits, and group support. Yet today, we live in a world where, despite our best intentions, it's oftentimes very difficult on your own to make the healthy choice. That's why we applaud what Mayor Bloomberg and Commissioner Farley are doing. Beyond our own individual efforts to make healthy choices, this kind of community-based support can help our society make major strides against obesity. To be clear, Weight Watchers does not pass judgments against any kind of food or beverage. In fact, we encourage our members to consume any type of food and beverage they like, including soft drinks. The challenge is to balance healthy eating with occasional indulgent eating in proper portion sizes. This type of mindful eating is an important habit to build in avoiding what we call mindless eating. So we hope that more mayors and health departments will follow New York City's example to promote a healthier environment and encourage citizens to reach a healthier weight. We hope that businesses also will make it easier for employees to be healthier too. We all need to take more personal responsibility for our own weight and eating habits, but it helps to remember what a healthy portion size is in a world where supersized portions have become the norm. In short, just a little encouragement to make the healthy choice the easy choice is always a good thing. This administration deserves credit for having the courage to step forward and take this and other actions to help New Yorkers understand the impact of overindulging, the impact that overindulging can have on their weight and on their health. In fact, just generating this conversation alone will help everyone internalize the impact of their decisions and lead to smarter choices more often. So we at Weight Watchers praise everybody here, praise you for raising this tough issue, an issue that must be addressed for the health not only of this great city, but also for our nation. Thank you very much.
Okay, thank you. Rachelle Conley lives in Queens, and she recently lost 91 pounds using Weight Watchers. Rachelle credits her success to physical activity and portion control, especially limiting the amount of sugary beverages in her diet. Rachelle, would you care to share a few words and tell you how you did it? Congratulations.
Thank you. Thank you. Good morning, everyone. My name is Rachelle Conley, and I've lost more than 91 pounds on Weight Watchers. The program has helped me to develop better and healthier habits, which include walking 2 to 3 miles a day, attending a 90-minute aerobics class 3 to 4 times a week, and limiting my sugary drinks. That wasn't always the case. Before Weight Watchers, I drank in the morning before work 8-ounce glass of a sugary drink. I had a cup of coffee before work with 25 packets of sugar. Yes, 25 packets of sugar. Then when I got to work, I had another cup of coffee with another 25 packets of sugar. With lunch, a 16-ounce soda. With an afternoon snack, another 16-ounce soda. When I got home, before preparing dinner, I had 3 8-ounce glasses of a sugary drink. With dinner, 2 more glasses of a sugary drink. Although I realized that those were not the best choices for me and my family, so I decided to make the change. I also realized that that was what made me put on weight. Today, now I consume coffee with no sugar, just cream, with an occasional soda drink. Those are all the drinks of my choice for me and my family. So for the first time in my adult life, I'm at my healthiest BMI, and my sons have also benefited positively with all these changes. I would like to appreciate Mayor Bloomberg, President of Weight Watchers, and Commissioner Farley for all that they're doing to make the change for everybody with limiting the sugary drinks. Thank you.
Rachelle, thank you. And Council Member Gale Brewer. Council Member Brewer, you should know, has always been at the forefront of trying to focus on making life better for not just the people in her councilmatic district, but throughout the city. Gale.
Thank you very much. With the mayor and the speaker, we did pass smoking, no smoking in parks and beaches, and I think that more than anything else, maybe as we get older, good public health trumps everything else. And that's why I'm supportive of the ban. I feel that the education that the mayor and the speaker have provided us, not just on public health issues, but also, for instance, finding affordable, good food with the health bucks and food stamps at the green markets. And on the west side, just because the mayor mentioned it, we have now every single individual at the senior center and homebound now gets fresh fruit and vegetables thanks to the green market. And every senior for $8 can get a whole bag of fresh fruits and vegetables every week. So we understand that from this education campaign, I grew up on Velveeta cheese. So let me be clear, this is new. I hate it now, but I grew up on Velveeta cheese. You mentioned the 1960s. 1960s, we ate Velveeta cheese. And so I understand the difference between that and what we're trying to accomplish. I think that the issue of the large beverage. I know I did a Manhattan neighborhood cable TV show with a wonderful doctor who works at the Department of Health, and she brought a big, I think it was a KFC cup with 64 sugars in it, poured it onto the set in front of the television. That kind of says it all. And I think that none of us want to be drinking that. We may not know that we're drinking that. And this education and the discussion that has ensued, I think, is incredibly important. And I hope it will actually lead to other things that we can change in our ways. So I'm here strongly in support of this. I do want to make sure, I would just add one other thing that we need to look at. We need more gym time for students in schools, because there are a lot of students sometimes in the building. We don't have enough gym time. Mr. Mayor, we don't have big places like this in Manhattan, you know, like fields and everything. So we need more gym time. We need more fields in different places. And we also need to work with the stores. There is an impact. There's a slightly imbalance on which stores can serve, which stores can't. All of this can be worked out. But the fact of the matter is public health, good public health, trumps everything else, and I look forward to working on this and anything else that makes New Yorkers healthy. Thank you very much.
Gail, thank you. As Gail knows, unfortunately, all these things we'd like to do cost money, and we are devoting some of the public's money to trying to make a better life for them. Nobody wants to raise taxes. We'd all like to have more facilities. We'd like to have more cops on the streets and firehouses and everything else, and smaller class size, all the good things. But unfortunately, the limited resources we have. Before taking questions, let me summarize today's announcement for our Spanish-speaking New Yorkers. Expertos en la salud y nutrición están apoyando nuestras propuestas de limitar el tamaño de bebidas azucaradas. Esta propuesta es parte de nuestros esfuerzos para darles información y opciones saludables a nuestros residentes. And with that, we'll be